Howdy, folks, and welcome back to Healthy Humor. I'm Doc MB, and with me today is my guest, Rebecca Stevens. I'm so sorry. I got really nervous there for a second. Rebecca Stevens. She is a physician assistant. She works with Oklahoma State University. She does clinical work, but she also works very much with students and recruiting. So we're going to kind of jump into it today. So, first of all, I'd really like to know, what your path was to becoming a physician assistant, because a lot of people don't even know what it is, and it is a relatively new specialty. So, kind of how did you migrate that way?
Yeah, so I had the fortune of having a mentor in high school that was a PA. And so that's how I initially got introduced to the profession. So it was one of my close friends' dads was a PA.
Okay.
And so I was like, oh, what's this? This is interesting. And from my perspective, when I was then researching college and like what I wanted to do, I was able to see firsthand the role that he had with the physician he worked with, and he was in orthopedics, and how interesting it was to me and how cool it was. And he was on the Friday night football sidelines, and I was a cheerleader, so like that was cool. Like it was all just seemed really fun. And so I was like, what does he do? And so then when I was learning about professions, he came to like a career day and told us all about it in high school, which most students aren't introduced in high school, so that was unique for me. So when people ask me, and I'm like, oh, I knew in high school or kind of when I started college, that was more unique. Now, when you go to university, I went to OU, ironically. Everyone's like, you just start pre-med. Like everyone's like, oh, I don't know. So I'm just going to say I'm going to stick pre-med on my board, and then see what happens from there. But I pretty quick realized that when I was doing research and solidifying what health career I wanted, that PA was what it was, and it was because of that first introduction. So I did undergrad at OU. I was a zoology major because there was no bio at the time. Apparently, they do have a biology major now. And then technically pre-PA, although that identifier at that time didn't exist either, although it does now, which is nice. And so then I, looked at the programs that I might be interested in going to and match my coursework for that. And then just kind of went from there, to be honest. So
okay,
yeah,
amazing.
Yeah,
it's kind of interesting hearing you say that, like, your first touch with it was when you were younger, and that's kind of what got you interested in it, because as we've talked about before, when we're working with students, we really encourage them that just because, I saw this, I went to a physical therapist, or had a physician assistant that I knew, like, just because you knew them or used one at one point doesn't mean that that's the career path for you.
Right, it is true.
But also so many of the individuals that I talk to, that is exactly why they went into what they went into.
Yeah, I think sometimes people will like start to be interested in a profession because they see a life of a person that they love. Like they're like, oh my gosh, like me. Like they were like, oh, Friday night at the football games, he was best friends with the orthopedic surgeon. Like they did all the things together. I thought, how cool is that, And so it's like, oh, I liked that life. But then, of course, you have to make sure you like the rest of it, right? So, but it definitely isn't. I think this is totally switching tones, but like that's the part of being impactful in your life, right? It's like if you are impactful in how you present yourself in your profession, then other people are going to want to do it,
Exactly.
Yeah.
So obviously getting into becoming a physician assistant, you had to do a lot of research into what it was and everything. And then now working with students, you're obviously constantly telling them, what it really is. So if you don't mind,
that's okay.
Could you go ahead and tell us what a physician assistant truly is?
Yeah. So we, by definition, are a healthcare provider, kind of liken ourselves to a extender. That was the original, PAs came about in the 60s, came from military medicine. It was like Army corpsmen were being trained in the military to be these very rapid-acting providers. And then when they got out, there was no, congruent training here yet for them. And so they were able to build this PA profession. It came out of Duke first. And they were like, okay, it's basically a medical model. So a PA is trained on a medical model, much like a physician, so a DO or an MD, which is a little bit different from, say, your nursing model, things like that. So we're trained on the ability to identify, diagnose, and treat patients. The difference, of course, between like a PA and kind of our other healthcare partners, besides the license, of course, is we are meant to be a partner. And so our license in Oklahoma especially depends on that of what we call a collaborating physician. And so when I have a job, I have my license and I have my own provider ID number because I write prescriptions and I see patients on my own. And to a patient, I might not look any different, truthfully, some days than a physician would. But on the back end, I have a collaboration and I have someone who is willing to partner with me, knowing that I had basically more rapid training
Mhm.
and require more on the job training, but then I can be molded into kind of whatever they want to work with.
Mhm.
And then just kind of embodying that like team based medicine, which we're really pushing towards. So,
Okay.
yeah.
So then I now have follow up questions.
That's
for that.
okay, yeah.
The first one would be if you're being, well, I guess I'll ask the first one.
It's okay.
The first one is what's the normal scope of a physician assistant?
Mhm.
Just, or I guess the broad scope of a
Yeah.
physician assistant. But then what is, what are the specialties within it? Because you're talking about being molded into
Yeah.
whatever the over the physician,
Yeah.
the, I guess, supporting provider
Right.
needs
Yep.
or clinic needs or whatever.
Yep.
So I guess what's the overall scope, and then what are the specialties within that?
Yeah, so the overall scope and the idea of PA school is you're trained in general medicine. Like
Okay.
that's how, and now I'm in education, I can even say that more like strongly. Like we train on the idea that we're training for a general kind of like, I'd say primary care, but primary care can encompass that either in a family office or an emergency room, but that general healthcare. So you know a little bit about everything, right? And so the idea is you train there, but PAs are actually employed in basically every healthcare setting.
Okay.
And so for me, for example, when I first graduated from PA school, I took a job at one of the big health systems here in Tulsa, and I worked with 4 physicians and myself and a couple other PAs at the time, but kind of came and went. I was there for 6 years, which is quite a long time for a first job as a PA. And I worked with 3 doctors that were family medicine and 1 that was double board certified in internal medicine and pediatrics. And I saw all of their patients. So I didn't carry like my own patient panel, but I was trained to kind of be a partner on if their provider couldn't see them,
Mhm.
I was there to fill in the gap, basically was my role.
Okay.
And so I was kind of trained on, pediatrics, internal medicine, family medicine to kind of be, but I was still my own provider, made my own decisions, but I had the idea of them kind of supporting me in the background.
Okay.
After that, when I actually switched careers and went into education, I do still work clinically, but I do cardiology now.
Okay.
And so I specialize essentially, and that's kind of one of the nice things about being PAs, it doesn't require additional training to switch specialties. It's kind of one of our, like, why people like it a lot, usually. And so when I was hired over by cardiology, well, in medicine world, cardiology is just a subspecialty of internal medicine. It's like the next step. It's like, internal medicine has general, which is adult medicine, complex adult medicine, really. And then cardiology is kind of a subset. And so I jumped into there. And so while I required, I would argue like more, I had more questions in the beginning and things like that, I was able to just try and specialize. And now I'm in a very, very specialty.
Right.
PAs are in family practice. They are in urgent care, emergency rooms, all specialty emergency rooms, surgery. They're in inpatient and outpatient, and pretty much every specialty that you could think of. PAs work in those fields.
So you get that ability to kind of switch when you want or when it's kind of necessarily because you might need a different lifestyle change for like personal reasons or things like that.
Yep.
But you're not going and doing an additional internship or residency
Right, no.
with other
Which
forms of medicine.
when we talk to students about that, like when I'm recruiting, and a lot of students in interviews are like, why do you want to be a PA? And they'll say, oh, I like the idea of being able to switch specialties. But I always like to remind them of course, it doesn't come at a price, right? So it's like I didn't feel comfortable in my first job until I'd been working, I'd say for maybe 2-3 years, I felt very solid in everything I was doing. And so when you switch, you almost have to start that process over. And I always liken it because when I was hired, they were like, one of the physicians said to me, well, we're here if you need us, but you've been doing internal medicine for 6 years, so you may not need us. And I said, well, what I'll tell you is I have book smarts, but I have no cardiology street smarts, which means like I don't know what actually works that the book doesn't tell you. So that's what I got to learn. You know what I mean?
Yeah.
And so that would be more of the concept. I'd be like, I'm out of options based on all the algorithms I know. So what am I missing? What have you seen work in your 20 years of practice of a cardiologist that I don't know yet? You know? And so that is the learning curve, I think, is like that kind of stuff that's like what works for your patient in that specific subspecialty.
Right.
Yeah.
It's kind of like you never want the doctor who's fresh out of med school. You always want the one who's been out for at least a few years and
to have an
seen
idea.
some things.
Yes, yeah.
Okay.
Knows
like
what
that.
works, yeah.
So, aside from the flexibility to kind of switch specialties and
Yeah.
things like that, and I guess that's more of a preference on the individual
Right.
side.
Some people never change, yeah.
Right.
Mhm.
What would make someone a good PA?
Sure.
Is there like a personality trait that's just like you would be great at this?
Yeah, so I think I think always our profession will tell you that it's going to be someone who is collaborative.
Okay.
And someone who has like a team mindset.
Mhm.
And the reason I say that is because I'm just being 100% truthful right here, right now. If you feel like you want to be a 100% autonomous PA,
Mhm.
you should be a physician. Like, if that's your goal, I'm not
Okay.
saying it can't happen. And autonomy in medicine for what we used to be called mid-level providers when I first graduated, which they don't like that term as
Mhm.
much anymore, is ever changing. I mean, just right now, there's like 3 different bills in the House to push different legislatures on our practicability. But at the same time, like, that wasn't where our profession rooted from. And so I think that sometimes, like, if that's your goal, then you would be better off probably going to med school, and then you can open your own practice with no red tape, right?
Right.
Whereas, like, so I think teamwork and collaboration are
Mhm.
just huge.
Okay.
Like, that's what I would always say. And then kind of going on, the ability to change is the ability to change, like the ability to be adaptable.
Mm.
So if we can have an interview where we see someone that we're like, teamwork, check, adaptability, check, professionalism, check, great PA, you know.
Gotcha.
Yep.
Okay. So, question I didn't know I was going to be asking today. You
You can ask
mentioned
anything.
these 3 bills.
Oh, yeah.
That's, I'm assuming, Oklahoma's.
Yes,
Okay.
Oklahoma. Yep.
So, what would those bills do?
Sure. So I will say one of them is PA.
Uh-huh.
2 are not, but they are kind of wrapped together because of what they're pushing.
Okay.
So there's House Bill, and I will botch these numbers, so I won't say them, but it's House Bill like 2548 or something close to that.
I can look
and
them
it's
up later.
Yeah,
Add 'em in
she's
the
gonna
notes.
look them up. So it's it's a PA bill, and what they're trying to do is give the idea that after so many years, it's 3.
Okay.
It's what's equivalent to 3 full years of practice that a PA could practice without the practice agreement with the physician.
Okay.
So it is
Yeah.
a big difference. So after 3 years, it's actually not 3 years, it's 6,208, yeah, whatever's equivalent. So, like, if you work half time for
Mhm.
6 years, that would get you there too, kind of thing.
Gotcha. Okay.
Or part time. And so that's the idea. So the PAs are backing that legislator, our PA lobbyist group is
Mhm.
backing that legislator. The other 2 bills are about other professions that kind of match ours. So one's for nurse practitioners, it's very similar. And then the other one is actually called the supervised physician bill. And I will say I'm not as versed on that one, so add it to your notes. But
Okay.
it talks about essentially, basically, it sounds like it's designed for maybe a med student who doesn't match initially,
Okay.
still being able to maybe work under a supervised physician to further their training.
Okay.
But I would go into the details on that one because I'm much more familiar with our bill, of course, because I get emails from our lobbyist group from the Oklahoma Academy of PAs saying, like, oh, look this up and see what you think.
Yeah.
So that's currently, they actually, all 3 just passed the House, so they're headed to the Senate.
Right.
They are all not new. They've tried this last year. They were pushing them approved, and they didn't get approved. And so then they made adjustments, and as they do, and now they've gotten through the House. And so it'll be interesting to see what happens. I'm not sure, so we'll see.
Since they haven't been approved before, and they're
Mhm.
hopefully going to be approved this time,
Mhm.
I think it would be great because I think that allowing individuals who do have this amazing scope and obviously high level of education and expertise to be able to practice without having that supervisory role, especially when you look at rural communities,
Right.
you know, I think that would be really incredible. So what is the pushback usually?
So usually the pushback is the idea that we're trying to take, I mean, this is speaking for myself, is that we are ideally, we are not physicians.
Mhm.
We don't have the training as physicians. So why are we now trying to change our license to match that of a physician who's had all this extensive training?
Okay.
So the pushback is kind of that, like,
Okay.
oh, then people won't even want to go to med school anymore. They're just going to want to do this faster route and then get out and practice, you know.
Right.
And there is also some pushback within the profession of PAs who practice for a long time that love having that like compact, and they love having that backup, and that
Mhm.
liability's not on them. Like,
Right.
we have a different malpractice insurance because we have that connection. Like, there's a lot of things on our side too that people are like, I'm not sure, you know. And the board is quick to tell you, like, when they send information about it, like, even if this passes, you can absolutely still have a practice agreement on file with the state, and you can still have a team, and you can still have your collaborating physician. Like,
Okay.
this is the option, and exactly what you said is to help try and get providers out to those rural areas to
Mhm.
where then there wouldn't be the red tape of, well, who's going to supervise this person?
Right.
And so that's kind of the push for it came from that world. It didn't just come, I think that's also some of the like, it didn't just one day they were like, well, I think we should try for independent practice today. You know, it came from a lot of research behind the need for healthcare in Oklahoma and how we could expand that.
Okay.
Because we are not turning over enough medical providers at the rate that our state, and I mean lots of states, but of course I'm rooted here,
Right.
is just getting sicker, you know?
Yeah.
We're not great at healthcare. We're
Right.
like 48th or something.
Yeah.
I think we're 50th
I love to
now.
I love to joke that
Yeah.
we're like 60th.
Yeah, I know, right? Yeah, we're 60th in healthcare, guys. We're
Yeah.
trying. And so it's like, what can we do to help our state, you know?
Yeah.
And so I think for anyone who is on the other side, I would just remind them, like, we aren't, I mean, me, not speaking for the entire profession, but speaking for people I know, like, we are here to be a team approach. We're not here to take over anyone's job, but if the team can be expanded to help people, that's everyone's goal, you know?
Right.
So,
whenever you have a physician that's overseeing or
Mhm.
supervising
yeah.
in that way, so you do your clinical work with OSU, but you mentioned before we started the actual interview here that you volunteer your time at a free clinic.
Oh, yeah.
So when you do that, is it, every time you're going to go present yourself in a different setting as a PA,
Yeah.
do you have to go get that approval from
Right.
okay.
Yeah, I've been volunteering. I volunteer at a clinic in West Tulsa, the forgotten Tulsa, everyone, because it's very poor out there. And people along Charles Page, if you aren't familiar with Tulsa, unfortunately, it's a very impoverished area. And so there's a clinic out there that meets the basic needs of people. So it's a food pantry, it's a clinic. They do GED courses, they do like legal aid, things like that. And I've been volunteering there for about 10 years since I started out as a PA. I actually found that because one of my collaborating physicians at the time was volunteering there, and he invited me to go with him. And said, hey, would you like to come start doing this with me? Well, because we went as a pair at first, he was already on my license with that company that I worked for, and so it didn't matter that we were changing practice locations. When I left and no longer worked with him, that was the discussion of adding that practice location as a secondary location that I would practice medicine. And then OSU actually works with that clinic a lot. So there were providers that were already out there. So it worked out to have. But yes, I do. I have Oklahoma State cardiology, and then I have neighbors along the line. So 2 different practice locations, and then different physicians that go with each place that are on there.
Okay.
Yeah.
So you wouldn't have the multiple physicians
Yes.
like that.
Yeah.
Okay.
Yeah.
I feel like that's something that is probably different because I know there are other fields out there where you have to have the supervising physician, and my understanding for some of them, which hopefully we'll find out when I have those guests on later, is that you have the one supervising physician.
Right,
You don't have multiple.
No, we have there used to be limits, and then they revised that to where it's like you can have many so it used to be that you had one main and you could have a lot of secondary.
Okay.
But now you can have multiple main and then lots of secondaries. And then a physician, it used to be that they could only supervise so many, but then they changed that too. They took off that restriction. And the reason that really was for like, if you have an emergency room or an urgent care that a physician staffs and they supervise all these PAs, they wanted them to be able to have all of them for whoever they're working with because there's so much shift work, you know?
Okay.
And so it was like they took away the red tape of being like, oh, I can only supervise 2 people. No, there's not that anymore. So, yeah.
Okay. So, I think that's one of those things where, like, obviously that was a misconception I had.
Yeah.
There was one supervising physician.
Yeah. No.
Are there other common misconceptions that people have when it comes to physician assistants?
So, probably the 2 biggest ones I can think of. Number 1 is that we are a medical assistant. So there's a training called medical assistant. It is a technical degree. A lot of students will do it young. And so that's the person now when you maybe go to visit your healthcare provider that calls your name, puts you in the room and takes your vitals, goes over your medications. That's a medical assistant.
Okay.
So if people are just really kind of naive to the profession or haven't been trained on it, then sometimes I've heard, or they're like, oh, you're like the person that rooms me. I'm like, oh, no, I'm the person that comes in after that, you know. And shout out to great MAs because we need them, and I love mine in my clinic. And that's would be the first one.
Okay.
And then the other one, and this is just kind of it's that I didn't get into med school, and that's why I'm a PA. And that's more of a personal one, which you can understand, you know, or I didn't want to do the work for med school, you know. I think that's because of the title and because of the function, and I get that a little bit, but what then I have to tell people is like, no, like when I was looking for healthcare, I was like, okay, do I want to be an MD, a DO, a PA, an NP, an LPN, an RN, like they were all so separate, and yet so we don't look at like a nurse and say, oh, you didn't get into med school, but for some reason we look as a physician assistant as like, oh, you wanted to get in med school but you couldn't make it, you know.
Yeah.
And so I think someone was like, oh, what'd you get in your MCAT? I was like, well, I never took it because I never wanted, that wasn't a goal for myself.
Right,
you know?
you never needed to take it.
And so that's sometimes, I mean, talking about like true misconceptions, I think those are the biggest too, you know?
Yeah.
That we are, again, like a medical assistant or versus like, oh, you wanted to be a physician, but you didn't get there, you know?
Okay.
So,
yeah.
And then in practice, which is just a funny one, so I just kind of thought of some of my older patients will ask me, oh, when are you going to finish your training? Like, when are you going to become a doctor? I get that a lot.
Okay.
And that may be because I work with residents now, and so they are still and then they are all full physicians, but they're still finishing their training. And I'm like, oh no, this is it. This is like what I want to do. You know, this is my end game. You know, and so that's always funny to hear as well that I'm still in training.
Oh,
you know?
that's funny.
I don't get that as much as when I was younger. Maybe that's because I now look older, but when I first started, I was young. Because I kind of went through, like, I'm a summer birthday, so I was always the young one. Went to college, did 4 years, went straight into PA school, and, like, I was fresh out, like, at 24 practicing medicine, and they're like, well, when are you done with your training? I was like, oh, I'm done, you know.
Yeah.
Now I've aged. Medicine's aged me, no.
I know. I'm somewhat excited about the day when I don't get, confused for being one of my students.
Yeah, but also you shouldn't be.
Yeah.
Yeah. It comes with a double sword. You're
right.
Like, ouch.
I feel like it'll be a bittersweet moment. Like, yes, I am the person of authority, but then it'll also be like, oh, do I look old now?
When they start ma'aming you, they're like, oh, ma'am. Thank you.
It's, So if you could, share one thing with people about physician assistanting.
Physician assistant. Is that a verb?
Is it?
It is today.
Yeah. I like to make up words, so.
I love it.
If you could share one thing, though, what would you love to have as kind of like a takeaway almost? Or is there anything that we haven't talked about that you would really like to bring up?
That's a good question. I think my one takeaway is, and so I say this about myself, and this is maybe my own mantra, but it's like, I would just always say, like, be willing to see a PA, because for my personal self, I have never had a patient who has seen me and then refused to see me again. I've had plenty of patients that said, no, thank you, and we respect that. Like, I want to schedule with my physician, that's fine, you know. But I think that a lot of times maybe the name throws people, because it's like, our training is adequate. We know when to ask for that extra help if we need it, or what extra collaboration when we need it. And so if a PA is treating you, like, you should have, an open mind about it, which I think most people feel that way now. I mean, the profession's evolved so much in the last 10 years, just since I've been in it, on, like, knowledge of the profession and, oh, I love my PA or whatnot like that. And so I would just say that, just always with anything in medicine, keeping an open mind about who's treating you and that we're there to help.
Yeah. Okay. Well, then I guess I have one final question before we wrap up.
Yeah.
Which is, if someone was interested in just finding out more about PAs, or possibly maybe a student listening or something who was interested in going to PA school, or again, just learning more about it as a potential career option, where would you suggest they start?
So there's a lot of great informational websites. There's a few, I can even share some with you to post. But if you're in Oklahoma, the Oklahoma Academy of PAs has a lot of what is a PA kind of stuff. And then our national board, which is the American Academy of PAs. So those two websites are really nice. There's another one that's like Become a PA or something like that we like to give out that has just like an overview of everything.
Okay.
But all of those are great resources. And then I always, try to say, if you're in the level of discovering health professions, like, sign up for some of these, like, on-campus days, or, like, like OSU, for example, offers high school and college, like, opportunities to come and see everything and see all the different professions. And, like, if your school offers those, do them. If they don't offer them, you can do your own research, absolutely, and kind of see what these different professions are like. But yeah, the research in the beginning would be maybe talking to someone who is a PA or reading about them on one of those websites. Oh, for sure.
Great. Yeah. And I would love to get those from you so I can post them.
I'll put them. Yeah, I'll send them your way.
Okay. Awesome. All right. Well, I guess we can go ahead and sign off then.
Okay.
Okay. Well, I hope everyone has a happy and healthy day.